This video is the hair transplant to create a feminine woman hairline. This client is a transgender. She, as you can see, had a scalp advancement procedure, left her with a straight linear scar in the front. Turn this way for me, and it went all the way from here and go straight across. So it's very difficult for her to wear her hair up or tie her hair in a ponytail. And, you know, scalp advancement does its job in terms of lower the hairline. However, that's the older method. Nowadays the method, and you still need a hair transplant to lower the hairline anyway. So more and more people opt not to do the scalp advancement and just go straight for the hair transplant, because the hair transplant will not leave you any linear scar. It leaves the scalp intact, so there's no numbness on the linear scar. It just transplants the hair on top of it. Again, the scalp advancement, which leave a linear scar, more invasive, the older technique. It works very well. Unfortunately, it's hard for you to pull your hair backward. Nowadays, more and more people just opt to go straight to a hair transplant, because even after scalp advancement, you still need a hair transplant to begin with. Hair transplant, as you know, is an art form, especially the hairline. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. And especially creating a woman feminine hairline is, you know, they require a lot of detail. When you do it right, you will frame the face and enhance the feminine feature, the eyes and nose and the cheekbone and all that stuff, and it will bring out your beauty. As you know, I'm one of the very few hair surgeons who specialize in the art of creating a natural feminine woman hairline, whether for a woman or a transgender. You can just Google it, transgender woman hair transplant would be for another photo by Dr. Diep. Anyway, on the average, from the mid eyebrow to the hairline, it's around 4.5 to 6 centimeters. So this client is roughly around 5 1/4, 5 1/4, 5 1/2, and that's fine. From the mid eyebrow, and then we had to bring the temple in, because otherwise the forehead's really wide and will look abnormal. From the midpoint toward the side, it's roughly around 6 to 7.5 up to 8 centimeters. And this client is around 7 centimeters. So from here to here, 7 centimeters. So, you know, when I create the hairline, I'm very precise too. I do the measurement from here, from the eyebrow to the hairline, from the midpoint to both sides. So, you know, bring symmetry. As you can see, if you can turn this way for me. There you go. Naturally, her angle, the tempo, has gone backward, and that's for men. Caucasian men most acute, Asian men less. Black men is perpendicular, but for women, it's pointed toward the midpoint. So, and furthermore, where the eyebrows end, for men, you put a temple, you put a thumb, and that's where the temple should begin. But for women, where the eyebrows end, it goes straight up, and that's where the temple should begin. And so that's, you know, it's a rule of thumb. It's not everybody gonna be accurate, but you do the measurement and you do rule of thumb. So that's really allow you to bring the hair and the hairline in, so make the forehead smaller. And so we brought the temple toward here, make sure it's aligned with the where the eyebrows end, as you can see. And once we get the shape down, and when I create the hairline, I create it very unique and according to each individual facial structure, as long as overall proportional and bring out the beauty of each individual. And then once we get that down, we will transplant at a very precise angle, start around 35, 45 in the front, increases when we go backward, and changes when we go different direction. It's very important that on the side we transplant flat against the skin and backward, and the front 35, 45. And then not only the precise angle, but the selection hair graft. We will transplant rows and rows of single hair grafts in the front, followed by root of 2 hair, 3 hair, and 4 hair in the back for bulk and volume. On the side, we will especially the temples, a lot of baby hair, root that grows single hair. So we're trying to transplant a lot of rows and rows of single hair graft. to make the temple soft. And the design of the temple not for density, is for softness and to frame the face. So this is the art of hair transplant on transgender to create a feminine woman hairline. And I can't wait for her a year later, because I hope she can allow me to show the full face, because it will bring out her beauty. She will look fantastic. Thank you.